Thank you very much for this nice research project. And we continue now. And I just wanted to make a small remark. A lot of you have been yesterday to the conference. And maybe you saw by one of the pictures that Professor Sackler showed was a very interesting article that came in Nature about the feasibility that one day we can create a tooth from germ cells. We want to get a little bit in depth into this issue, and we are going to hear now a lecture for the second PhD student from Sandra Treves, and she will show her presentation from the laboratory of Professor Sandra Pitaro. Please.
Okay, I'm shorter than Racheli. Good morning, everyone. Before I begin, I would like to take this opportunity to thank the Orthodontics department and the staff for an amazing and very, very interesting learning experience and for introducing me to the world of orthodontics. Second, I would like to thank my PhD supervisors, Professor Pitaro from the Oral Biology Department and Professor Verdimon for the encouragement and guidance in my PhD thesis. Then I would also want to thank my classmates of PG7 for their everyday support and for wonderful and I hope a lifetime friendship. And last but not least, I would like to thank my family, my husband Doron, my children, my parents-in-law, my sister, my grandparents, everyone that helped me go through those years. It was very difficult to combine everything, family, work, studies, and I couldn't have done it without you. Thank you. So, my talk today is related to the oral mucosa, and more specifically to the stem cells in the oral mucosa that we consider as a new hope for regenerative medicine. First, I would like to introduce you to the concept of stem cells. Then, I will show you why the oral mucosa stem cells are a very unique population of cells. And then, I will focus on my PhD thesis, which is aimed to testing the utilization of oral mucosa stem cells in the regeneration of oral tissues. Stem cells biology and the utilization of stem cells in medicine is a very complex issue and subject. So I will try to speak in a way that everyone here in the audience will understand, because I know that it's a mixture of people. And if you have questions, please be free to ask me. Okay. When we talk about stem cells, we consider them as a class of primitive and young cells that are found in all the tissues in our body. They retain the remarkable potential to develop into many cell types and tissues that form and maintain our organism, such as muscles, such as nerve tissue, such as bone, etc. Therefore, stem cells are crucial building blocks in the development of our organism, in the homeostasis, which is the everyday maintenance of the well-being of the organism, the pathogenesis, which is the development of disease, and they take a very active part in wound healing, in repair and regeneration. The ability of those cells to grow and to form tissues is called stemness, or potency. According to this ability, we classified stem cells as totipotent, pluripotent, multipotent, or unipotent, and I will elaborate on this. Totipotent stem cell, as we can see here, is actually a single-cell embryo. This is the first fertilized egg. This is the most potent stem cells because it gives rise to all embryonic and extra-embryonic tissues, such as the placenta. Pluripotent stem cells are what we call embryonic stem cells. They are formed 5 to 7 days after the fertilization in the embryo, and they are capable to give rise to all the tissues in our body. This is the reason we call them pluripotent. And just for your knowledge, an embryo of 5 to 7 days is just before its implantation in the uterus, and during IVF procedures, this is the time when those cells are returned to their mother. As we grow older, the number of stem cells and their stemness, that means their ability to produce large of tissues, is decreasing. As we grow older, their number and stemness is decreasing. Therefore, this is the main reason why we cannot renew and repair our tissues in the body. And as a result, we're getting older, we're getting sicker, and eventually we die. So in order to compete with this to overcome this biological problem, and to try and treat degenerative diseases such as Parkinson's disease, and age-related diseases such as periodontitis and arthritis, we need to bring stem cells into the tissues that are sick. So there is a need for stem cells therapy in medicine. And now the question arises, is where can we take stem cells from? What is the best source of stem cells in the body? We can take stem cells from the embryo. Those stem cells, embryos that were leftovers of the IVF procedures that were not being implanted back to the mother. As I mentioned earlier, the embryonic stem cells are pluripotent, and they should be the best source. They can create all the tissues in the body. But obviously, there are ethical problems in using those cells, and furthermore, those stem cells form tumors when they are implanted back in the body. So they are not safe, and we cannot use them. This is an embryonic stem cell, as you can see, after 5 to 7 days. The second source of stem cells that we can use are stem cells from the blood cord, from the umbilical cord. These cells are already being used in clinic to treat children with leukemia, lymphoma, and other types of cancers. However, their quantity is very limited, and they cause an immune reaction because they are not always taken from the person in need. So what we are left with is stem cells from the adult. There is a storage of a reservoir of stem cells in the bone marrow and in our fat tissue. These cells can be isolated, and some of them are being used in clinical trials. However, as I mentioned before, the stemness or the potency of those cells and their number is decreasing with age. And if we are talking about an old person that needs those cells, we might not be able to use them, even if we find them. So is there a better alternative? Can we find a better source of stem cells in our body? In the next few minutes, I would like to show you that the oral mucosa is a better alternative. The oral mucosa is the tissue that covers all the mouth, the gums, the lips, the tongue, and inside the cheeks, and so on. As dentists, and also as people, we know that there are a few clinical observations that everyone is aware of. We know that wounds in the mouth heal faster than in the skin, for example. Here we can see a biopsy that was taken from the mouth and from the skin, at the same time and then the same size. After a few days, we can see here, we hardly see the biopsy, okay? And in the skin, you clearly can see it. So after 3 days, you can see that the regeneration site heals very, very fast in comparison to the skin. Not less important is the fact that aging does not affect the process of wound healing in the mouth. We can see the same type of regeneration and healing in a 15-year-old girl. In this picture, we can see this lesion, and after a few days, nothing. And also in a 55-year-old person, you can see this lesion, and after a few days, nothing. Without any scar formation, without any remnants of the illness, nothing. Not as we see in the skin and in other tissues. So this type of wound healing reminds us the type of wound healing in the fetus. So you can see three actual things: the rapid healing compared to other tissues, wound healing by regeneration, and the rate and type of wound healing is not affected by age. So based on these observations, Professor Pitaro came with the idea that a young stem cell population resides in the oral mucosa and is responsible for this unique type of wound healing. And in order to test this hypothesis, the group in our lab has tested the two major biological properties of stem cells: their capacity to renew themselves and their potency, the ability to form a large number of tissues. What we did is took small biopsies from the oral mucosa and put them in a culture dish, and every time that they filled the culture dish, we took them out and counted them. And what we saw is, from a very small biopsy of 3 to 4 millimeters, we could generate more than 2 trillion cells under regular culture condition after 40 days. I want to tell you that 2 trillion cells is the size of an organ. After 40 days, we could create an organ. Of course, we couldn't hold all the teeth in the incubator because we needed the full stage of incubators, but if we would have grown those cells, we could generate an organ after 40 days. It's a very unique property of the oral mucosa. Cells from other tissue cannot proliferate in such a way, and we have an unlimited amount of cells. Second, I would like to emphasize that we got the same result when we tested biopsy from older people. Furthermore, in order to obtain the very small biopsy from the oral mucosa, it takes only 5 minutes under local anesthesia and without any morbidity. And if something goes wrong, we can easily take another biopsy. We have an unlimited source of cells. And now let's see what these cells can do in vitro, in the test tube. Under special conditions, we were able to direct those stem cells to form, from the oral mucosa, to form bone. Here you can see the red staining of mineral material. To form fat. Here you can see the red vacuoles of triglycerides. To form cartilage, this blue staining is a specific staining for cartilage. And as you can see here very clearly, nerve cells. Okay, so we saw that those cells can do very wonderful things in a culture. And now we wanted to test how are they doing in vivo situation when we put them in mice. So we took those small biopsies, we cultured them in the test tube, and we put them in the mice. And we saw, after a few weeks in the mice, we saw that they create a mixture of tissues. Here you can see neural cells, epithelium, muscles, fat, and cartilage. So the growth capacity and the potency of stem cells from the oral mucosa is unique, and they are not affected by age. And now I want to focus on the dental field. A major problem in orthodontics and periodontics is the lack of new cementogenesis. As orthodontics, we are very familiar with this phenomena of root resorption after orthodontic treatment. And also we're familiar as dentists to this situation of periodontitis and loss of all the periodontal tissues of the teeth. Is there a way to restore and regenerate those tissues that were lost and to bring their form and function as they were before? If we can create new periodontal tissues, such as new cementum, new bone, and new PDL, maybe we could prevent these things to happen. So I tried it. I grew up these cells in the test tube, and after a few weeks, under special conditions, I saw this. This is a very constricted and large mineral tissue, and this is under a microscope. So I tried to test it in vivo as well, in mice. What we did, I grew up those cells in those fibrin membranes for 2 weeks, and then I implanted them inside a mouse. And we waited for 8 weeks in order to see what grows there. After 8 weeks, we can see that something grew up. This is like a hump or swelling. And when we took out the skin, we saw this. And I took an X-ray picture, and I saw that what grew up has some kind of mineral material inside of it. So I checked it histologically, and I wanted to see exactly what grew up there. And this is in a large scale. You can see this is what grew up, the swelling, and this is the calvaria of the mouse. And this is in a higher magnification. You can see that those gray stainings are staining for mineralized tissue. And you can see that the cells that are surrounding those mineralized material here are secreting this. Okay? So what I did, I tried to analyze what kind of mineral material I have. So what we did, we checked for specific proteins, and especially specific proteins for cementum, as cementum attachment proteins, and also proteins that are similar to bone and cementum, like bone sialoprotein, alkaline phosphatase, etc. And you can see that there is a very clear positive staining for cementum attachment protein. That means that what grew up in the mouse was actually cementum. We could create new cementum from the oral mucosa stem cells. So, on top of the two conclusions that I mentioned before, that growth capacity and the potency of oral mucosa stem cells are unique and are not affected by age, we found that those cells can form new cementum in vitro and in vivo. So maybe in the near future, we will be able to treat periodontitis and to regenerate a resorbed root and to prevent the ankylosis of teeth that were avulsed, and maybe we can grow new teeth like Professor Sackler mentioned yesterday. So, except from the dental field, what our lab is doing next, we tried to use those oral mucosa stem cells in order to treat other tissues, like brain tissues, to treat Parkinson and Alzheimer's disease. We want to direct those cells to liver cells in order to treat liver disease, to pancreatic cells in order to treat diabetes, and in heart disease in order to treat heart and damaged tissues and cells after heart attack. So I know that there is a lot of work to do, and it's not the answer will not come tomorrow, but this is the future. And I would like to thank my colleagues at the lab. It's a whole team of people because it's a very complex and complicated work. This is my supervisor, Professor Pitaro, and my friends in the lab. And also, again, I would like to thank my family that were with me all the way, and thank you very much.